Hello and welcome to the sixth COPASA Social Accountability Dialogue, which is themed Integrating Social Accountability and Legal Empowerment Approaches in Roma Communities to Strengthen Access to Right to Health. I, Surekha Daleta, on behalf of COPASA Secretariat and COPASA Communication Hub, welcome you all in this dialogue. As it might be known to all of you, that COPASA is a global network of accountability practitioners from the Global South, sharing a community-centric vision and human rights-based approach to healthcare and human dignity. COPASA launched a social accountability dialogue series in March 2017 and intends to enrich the field of social accountability with insights and experiences from the field of accountability practice from across the globe as well as from local and regional level. The dialogue today is sixth in the series. The dialogue is being hosted on the Zoom platform and it will span across around 90 minutes, out of which 45 minutes will be dedicated to presentation and discussion. So we would request you all to kindly stay online till the dialogue is going on. At the bottom of your screens, there are some icons like the chat window. If you have any message or questions, they can be dropped in through this chat window. And we would request all of you to let the speakers finish first their presentations, and then you can ask for questions or make any comments or inputs if you have. And please keep yourself muted when the speakers are presenting themselves. The speakers will respond to your questions and comments after the presentation. And please do identify yourself while you are making a comment or asking questions or sending in some input. Now, I would like to invite the COPASA Global Secretariat Coordinator, Edward Prendas Pinto, who will introduce to all of you the theme for the day. So over to Mr. Pinto.
Hello friends, good afternoon and good morning to some of you who are in the other parts of the world. Can you all hear me? You raise your hands. Yeah, okay, great. And thanks to all of you for joining in. I think there are several friends who will be joining us shortly. But to keep up with the time, let us get going with this social accountability dialogue right away. Today's theme is very interesting. It is concerning the social accountability and the other approaches with the Roma people. Now, most of us have heard about Roma people and some of us know more about them. And some people have maybe not been fully informed about the situation and the context and the rights of Roma people. Today we are privileged to hear the voices from the ground, from our friends, that is Borjan and Fadil, who are in the midst, who are working with them and in those Macedonia and those areas. And we really are grateful to them for joining us today to provide us the first-hand experiences and inputs from them. It is very interesting to note that most of the oppressions of Roma people that we hear is happening in the midst of Europe. Europe has set several benchmarks for us in terms of human rights, in terms of ethics, in terms of development, in terms of several other things. But it's very disheartening to note that in the belly of Europe lies a large population which is not even considered citizens, and they're refugees in their own countries. And the oppressions and exploitation that we hear in many parts of the world of tribals, of indigenous people and others, and we hear happening to the Roma community, Roma people, day in and day out. They have been ousted from several countries and they live as homeless in their own states in the midst of Europe. And while this is a very sad story, what is heartening to know, there are civil society members, organizations like ESC and others are facing these challenges and taking the law authorities head on and asking for the accountability for the rights of the Roma people. And today we are fortunate to be connected to some of them through COPASA network. who some of them also have traveled to India to learn about the accountability work. Some people have traveled from India to their places to facilitate their work. And we have been quite excited to know that several efforts that have been done in these countries. Today, of course, we are having the first part of this dialogue to know more from Macedonia and surrounding countries. We have also friends from Bulgaria who could not join us due to some technical reasons today, and their experiences we will again come back and get to know after a month or so in part two of this dialogue, and to know more about Roma community. And at the outset, I would like to thank Dr. Borjan Pawlowski and Fadil for joining us, for their efforts. And we also want to congratulate them in advance for the kind of work that they do amidst challenging situations, which are very, very challenging compared to some of our own conditions. And without wasting much time, Surekha, we will get on to this, to hearing our friends. And Surekha has already informed us about the structure. We have a video on the Roma community, a short video, followed by two presentations, after which I will be facilitating the discussions and answers. So this platform allows us for direct interaction, and you can keep your audios muted now, but when you do want to speak, you can unmute your audio and we will hear you directly. And you can also keep your videos on if it allows you to interact at your end through this platform with us freely without interrupting the internet. So now we move and we welcome to our, lastly, I welcome all of you to this discussion. I hope that all of you will make it for this till the end of this dialogue for about 85 to 90 minutes. We will begin with a short video on the life of on the Roma community to set the context. Who are these and what do they face in these southeastern Europe and in the surrounding countries? And then we will go on to the presentations. So let us have the video, please.
Imam 9 deca, to su unucina imam, jer ima neki vakcina, ima neki nevakcina, ima ne prijavili, imam neke neprijaveno, to vodi mi svi u ulici, bez 8 godina, tuka su 6 godini, bez kuća, nije sve tuka bez prija, bez voda, nema mi kada da se perimi, da gledam i televizija, nema klasu, te djeca nikad nisu. Imame djeca polni tuka, imam unuka su skepni, niko ne daje tuka da ne pomaga, niko ne dođe tuka da ki vakcinirat našite djeca ili da ki predviđat za zdravstvo, za ova, da ki pomaga našite djeca.
Znači, nema samo kraja. Kako se boje našite djeca, i nosi me daleka? Dođe ti kaži, ne kažu od toga mene. Ti si ovo vakcina primaju, nije. I neki trošku, ti da ovdje, koji naš misliti Boga, ljudi me tamo ne plaća mi ništa, oni znači ovdje tamo se znam. I zato, znači, ništa nema prima.
Ni kažu vam, ako neki vakcinirali djecata, neka se dobije nekakvih paket zaraznih bolesti. Ni socijalno se ne bavi, ništa djeca. Po kontinentu. Сите деца вака. И другите мали ми одат по континент, без во школа, да одат тие по континент. Ги запиша во школа, нема услов како да ги праќам, и ги извади. Па живина како кабе шаман. Pani, ništa da nema života kasno. Će ne fina nema, i tvano te ne pisati.
So we just saw this video which highlights the ground realities of the Roma community. Now I would like to invite the first speaker for the day, that is Dr. Boryan. Dr. Boryan is a coordinator for public health and women's health at ESA in Macedonia. He is the steering committee member of COPASA, representing the Central European region. He works on human rights and promotion of women's health and health of marginalized communities with focus on Roma people. Besides this, he is working on improvement of budget transparency of health institutions and increasing the efficiency in the implementation of measures for preventive health care and use of funds from the budgets on national and local level. So I would like to invite Dr. Boryan. So kindly proceed.
Thank you very much, Surekha. Can you hear me? Oh.
Yeah.
Okay, perfect. Thank you very much. Good afternoon to everybody, dear colleagues and friends. I would like to thank to the COPASA Secretariat, to Surekha and Premdas and the other colleagues for giving us this opportunity to present our work with Roma community in Macedonia. First of all, may I please ask you, Surekha, to share the presentation?
Yeah, we'll share it. You can start meanwhile.
Okay, thank you. You have already seen the video, and I will give you just a very background regarding Roma. Brenda's already mentioned some of the issues. Roma people, the largest minority in Europe, people without their own country, but distributed across the Europe as a minority. They face many disparities regarding the rest of the population in Europe, including lack of education, low employment rate, low educational rate. Most of them live in poverty. Okay, just hear me. I was trying. Okay, I will try to keep the mic closer, and I hope it will be better.
Now it's clear. Keep the mic closer to your mouth. Now it's clear. Yeah.
Yeah. Okay. Thank you. Thank you. Thus, most of them live in poverty. Most of them face poor housing conditions. Even in many countries, they face forced evictions. Many of them are in some part of the Europe are travelers and so on. This results in great health disparities among Roma people comparing to the rest of the population. For example, it is estimated that in Europe, Roma people, the life expectancy of Roma is 10 years shorter than the rest of the population. They face, most of them, the burden of the disease among Roma, including communicable and chronic diseases, is much higher than the rest of the population. In Macedonia, I would give you just a brief context on Macedonia after that. In Macedonia, the data shows that the Roma people, the infant mortality rate among Roma people is 1.5 times higher than the Macedonian population. And around 50% of Roma in Macedonia died before reaching the age of 65 years, compared to the 23% of the general population. And the life expectancy in Macedonia for the overall population is 74 for women and 72 for men. So Roma face multiple negative social determinants of health, as we have already seen, and they face multiple barriers in access to health. Roma people are also facing discrimination in the healthcare, which is also a big problem, not just in healthcare, but generally in the country where they live. They face discrimination both in public and private sectors. So I will just ask you, Surekha, to go back to the previous slide.
This one? Or the previous one?
Yes. Okay. The components of the session will be the chronological background of the implementation of the methodologies and of social and legal empowerment. We have conducted merging process of these two methodologies, and I will explain why and how we have designed the implementation of the integrated approach. Yeah, please, the next. So, as obvious, due to the conditions in which Roma people live, our focus of interest of the work is improvement of Roma health in general, and with the main emphasis on Roma women and children regarding improvement of reproductive health of women and health of mothers and children. We are working in partnership for organizations. ESE, organization where I work, provides continuous technical assistance and support to our Roma partner organizations. We develop methodology, we strengthen their capacities, and help them in their everyday work and conduct the monitoring process. And our partner Roma NGOs, which are IRIS from Šuto-Orizari, we have one informal group of community activists from the same municipality, and another NGO, CAM. They conduct the work in the Roma communities. We work on local level in Roma communities, but we also work on national level. Because just a short background on regarding Macedonia. Macedonia is a country in southeastern Europe. We are a relatively small country. We have 2 million population overall. And by official numbers, Roma represent 3% of the population, but unofficial numbers is that the number of Roma people is much higher than this. We have a very centralized health system because, of course, we're a small country and the health system is centralized, managed by the Ministry of Health. And we have only one publicly state-owned health insurance fund. This is a context on the Macedonia and the healthcare system, very briefly. So the next, please. Yeah, the next one. I have already spoken about this. The social accountability work. Next one, please. Yes, we have started social accountability work in Macedonia in 2011. With the support by the Open Society Foundation. And as Premdas already said, we also have consultants from India and other places of the world in order to introduce this methodology in our work. We have started first with the health of Roma children, especially addressing the immunization coverage of Roma children, because despite in that period, in 2010-11, the coverage with immunization in Macedonia was not a problem on national level. We had above 95% of coverage. But coverage among Roma children was, for certain vaccines, even as low as 35%. So we have started addressing this issue, and the government, for the first time through our advocacy activities, adopted specific measures in one of the national health programs, Program for Mother and Children, specific activities to increase coverage of Roma mothers and children with preventive health care. That is why, upon this, we have started to do community monitoring work on these programs by the Ministry of Health. These programs are adopted annually by the government and prepared and conducted by the Ministry of Health. So these are the programs for active health care of mother and children, for checkups for pupils and students. We also do monitoring on the health services in immunization departments, and the program for early detection of malignant diseases, which have components for screening on breast and cervical cancer screening, and also health services with registered gynecologists on primary level. So basically, we are monitoring all mainly preventive services for the reproductive health of the women from the preconception period, antenatal care, and care for the children after they are born, with main emphasis on immunization, but also other preventive measures. Next slide, please. What social accountability methodologies do we apply? We work on the community monitoring within Roma communities, also social audit in Roma communities, and we combine our work with budget and programmatic monitoring of the programs that I have mentioned and analysis on national and local level. So we are mainly in our work trying to pursue the vertical accountability of the healthcare system, because as we have said, we are a very centralized health system, and many times you must see all the levels from the local to the national to pursue the accountability and to demand fulfillment of the health rights, because usually the local level do not, health institutions or authorities do not have sufficient funds or means to influence on the change. The change usually must come from the national level. As you are, most of you already aware about the community monitoring, we have actively involved Roma people in our preparation and implementation of the activities. We were working on increasing the awareness among Roma for the importance of the healthcare services subject to the monitoring work. This was a big challenge from the very beginning of our work, because having in consideration the condition in which Roma people live, for them, access to preventive services and immunization was not a priority issue. Although it's very important, but it was not priority for them because they struggle for their everyday life and everyday existence. So healthcare in general was not perceived as a priority, and even preventive health services not at all. But we were working and still working on this a lot from the beginning of our work until now. We were also continuously strengthening the capacities of our partner Roma civil society organizations to work on the selected issues, because many of them has never worked either on health area at all or not on these specific issues. We have strengthened their work to work on the monitoring on the health services, but also regarding the implementation of the methodology for work. Also, Roma community they lack health education and health literacy, but also they lack knowledge about their rights to health. So they are not aware what are the governmental programs, what is the health legislation, and to what rights they are entitled as citizens and as patients. So we are also increasing their awareness regarding their rights, so for them to be able to proactively demand for fulfillment of their rights. Yes, so also through our work, we have tried, we started immunization, but we have expanded our work, as you have seen, to many services, to many other services, including outreach or visiting nurses, which have mandate to visit women in reproductive health, women during pregnancy, and women and children after the delivery. And we have expanded our work also on the preventive services by the gynecologist. All of these issues of the expansion of our work were identified by the community members themselves, by the problems deriving from the community. Because we have seen that just that they are not immunized, the Roma children, but also that the Roma women are not visited by the visiting nurses, that they lack access to gynecological care on primary level. So that is why the community themselves identify these problems, and we have expanded our work throughout the years. Also, in our work, we are involving the community in the advocacy process, both on local level, more on local level, with the health providers, in order for the health providers to provide the quality of services offered and to increase the coverage, but also Roma community members are involved in the advocacy on national level. The next slide, please. Yeah, so these are the concepts. We conduct empowerment, as you said, on the community, then community inquiry and advocacy. Probably most of you, as most of you already are aware, we use the community scorecard in order to present the findings in front of the community, so to be easily understandable to the community. And we repeat the preparation of the community scorecard in each 2 years, but also we do policy briefs and policy papers for the relevant stakeholders, which are in a more statistical manner presented. So we do both analysis, simplified in the community scorecard and more statistically and policy oriented for the decision makers. Next, please. We do the social audit. You are aware of the social audit, the concept. It's a process of verification of the data. There was some voice.
Yeah, we would request all of you to please keep muted while our speakers are presenting. So kindly keep yourself muted. Dr. Boryan, kindly proceed.
Yeah, thank you. We have also conducted a social audit, and I will tell you on what. Next slide, please.
We can't hear.
Next slide, please.
Dr. Boryan, we can't hear you. Can you speak more loudly?
Can you hear me now?
A bit loudly. Can you speak more, a bit loudly?
Can you hear me now?
Yeah. Please go ahead.
It's better?
Yeah.
Just a moment, I will try to wait, okay. Now it's better, right?
Yeah.
Okay. Just a moment, sorry. I will try to improve the sound of the mic. Yeah, okay. The previous slide, sorry. Previous slide.
Previous one?
Yeah, okay, yeah.
Hanji, boliye.
In our social audit work, we have conducted. social audit on the diaries for visits from the outreach nurses, visiting nurses, Roma communities, so to verify whether the data that they have entered, whether they have visited certain families or not, is true, and what is the satisfaction from the services provided. We have seen that unfortunately these visiting nurses often note in their diaries that they have visited Roma family, but the visit did not occur. Or, for example, they will know that the visit was, during the visit they have offered plenty of services, but when we have asked the Roma people, they have said that even they were visited, they were not offered all of these services which were stated. And all of these findings were also used in our advocacy work for the improvement.
Hello?
Yes?
हाँ जी बोलिए.
Can you hear me?
Yeah, we can.
हाँ तो आ जाइए
Susie,
ना.
can you please mute yourself? Yeah, kindly proceed.
Okay, thank you. Yeah, and we have seen that the outreach nurses, visiting nurses, are not performing their work properly in the Roma communities, which was also one of our main advocacy goal to improve the quality of these services in the Roma community. And also we have done monitoring, social audit, sorry, on the coverage of Roma women with the program for cervical cancer screening, because Roma women, all the women must be invited by their gynecologist to perform the screening. And we have checked the list of the invited women submitted by the gynecologist with the community. And also we have seen that only very few, only around 20% of Roma women were really invited for this screening, and not in larger percentage as it is with the general population. Next slide, please. Next slide, please.
Yeah.
Yeah, I thank you. As we have said, pursuing the vertical accountability, every year we do the budget monitoring work regarding these programs under the Ministry of Health, because each of these programs has a very specific budget breakdown by activities. So doing this budget and programmatic monitoring of the preventive programs under the Ministry of Health, we investigate whether the coverage of target population is as it is planned in the program, to assess whether the budget is executed as it was planned, and to monitor the trends and variations of the planned and executed budget of the programs. We have seen in our work that the budget aimed for activities for Roma people is very often shortened or cut off during the budget year. As you can see, this is the budget allocation. This one is the budget allocation for the Roma activities, which is going up and down every year, and it was totally erased from 2015. Now in 2018, for the first time again, we have budget for the Roma people and for the Roma communities regarding improvement of mother and child health. Okay, next slide. Yes, as I already said, we use the findings from all of the methodologies, we combine them, and we advocate for improved coverage of Roma people with the preventive healthcare services, but also for the improvement of the existing services and improve quality and maximum use of available resources for the health programs, because not just for the Roma, but the budget for the health preventive programs is there are big problems in Macedonia, because usually this budget is cut during the year and not sufficient amounts are allocated for the preventive healthcare in Macedonia in general. As I said, and the advocacy is done with the involvement of the community. Next slide, please. What are the main achievements of our work so far? That we have increased the immunization coverage of Roma children in the communities where we work, not on national level, but in the communities where we work. We have improved the services in the immunization department, and those by the home visiting nurses, improved quality of services. And again, there are adopted specific measures aimed for Roma communities in national preventive health programs with proper budget allocation, but also also our improvement is seen through the higher involvement of the Roma community in all of these processes, especially in the advocacy and their empowerment and their usage of our services. Thank you. Yeah, next slide. We also provide paralegal assistance and support. Fadil after me will talk a little bit more about this, but I will just give you an overview. Next slide, please. Yeah. Also, as the social accountability work, a role in provision of paralegal support is to coordinate and support Roma partner civil society organizations, which are offering paralegal assistance in the field, in the Roma communities. So the same NGOs are offering the paralegal assistance. We are building their capacities and provide training so that they are able to provide the paralegal assistance. Paralegal assistance. Paralegal
for 10 minutes. Agla 10 minutes I can't give you.
Sorry? Should I finish?
No, there's an interruption in between. Sorry, continue, Dr. Boryan.
Okay. So we provide training for the paralegal, and the paralegal assistance is mainly regarding fulfillment of the health rights, or if the health right is violated, but also fulfillment of social rights and other related rights. Because next slide, please.
Yeah.
Yeah. We I will just briefly go through the slides since we'll talk more about this. They do a lot of activities on the ground, not just providing assistance to individuals, but also educating people and also meeting with relevant stakeholders depending on the problems that the people face. So this is assistance to the individuals when they face certain problems. Next, please. Yeah, as I said, we organize continuous trainings for paralegals, aiming and increasing their knowledge and skills, and 2 trainings usually are held annually. They are thematic trainings. Next one, please. Because we have seen that many people are recognizing and addressing paralegals for different issues, although we have started as an assistant in the health rights, we have decided to expand the knowledge and the capacities of the paralegals, community paralegals, and that's why we have started training them on a broader aspects like the labor law, criminal law, family law, court system and police, domestic violence, and so on, so that they are able to address all the needs that are deriving from the community. The next, please. Okay, this is the case management system about the paralegals. Fadil can talk more about this. Next, please. Yeah, again, thank you. So, as I have stated in the beginning, since 2011, we were conducting two methodologies in the same Roma communities with the same Roma organization. The social accountability work, which led to evidence-based advocacy with main goal to improve access to healthcare services, which was community-based, and also the paralegal legal empowerment through the paralegal assistance and legal aid and strategic litigation as well. All of these components to assist individuals to fulfill their right to health, but again, with the main goal to improve access to health services. Thank you. Next slide. So, doing this work since 2011 until 2014, we have recognized the need for merging of the approaches. Why? Because the same organizations were offering these services in the same communities, but often not the same people from the organization were working on both approaches. So sometimes we were missing opportunity. When the social accountability work is conducted on the field, maybe people involved from the community also need paralegal assistance, but they do not recognize that it's the same organizations often because they see different faces. And also people working on social accountability were not trained as paralegals, so they cannot recognize or offer support. In the same time, when the person is addressing the organization for the paralegal assistance, the paralegal from the organization is not trained for the social accountability work, so they cannot offer them help or education regarding, let's say, right to health for mother and children or women reproductive health. That is why we have asked our question, can we offer more comprehensive model, and can we improve the community involvement in the work, and can we improve the efficiency of the work of the field staff? Next one, please. So that's why in 2014, we have decided to merge these two concepts in order to improve the health of Roma through improved access to services and fulfillment of their right to health. The next, please. The planning process took us almost 2 years since 2014, and we have started the merging process in 2016. In the planning process, we have used also contacts with our colleagues from COPASA, both from India and from Latin America, in order to do the planning process, and they have helped us a lot. So in the planning process, we have developed the methodology for work of the merging process. So we have made a structure in the Roma civil society organizations in the form of animators and facilitators. So the facilitators are NGO members, which in the merge process work both as paralegals, offering paralegal assistance, but also conducting the social accountability work. And they were trained in those 2 years, they were trained to do both, to work on both issues. Animators were people from the community itself. Those are not members of the NGOs, but they are helping the facilitators in their entry in the community and to achieve higher mobilization and participation of the community. Also, we did very precise selection and of the localities where the integrated approach was supposed to be conducted. And it is conducted right now. In the previous period, the organizations, although they were doing mapping of the community, they were working in the entire municipality. For example, Šuto-Rizar is a very large municipality. Fadil can tell you more about that. And it's difficult to cover all the people with 1 or 2 civil society organizations. So usually, although they were working in the municipalities, they were not always, they have dispersed their work throughout great localities. That's why in the integrated approach, we have done very specific mapping and selection of the households where we will work. So now our work is focused, and each a facilitator and animator knows exactly with how many households and which household they are working with. We have conducted entry in the household, and during the entry, we have conducted a questionnaire to assess the health status and health needs and barriers to access to health services of the Roma people, and to provide them information regarding all the services offered by the civil society organization, paralegal services, but also to provide information on the issues of the health of women and mothers and children. And we are doing education of Roma community as well. Next one, please. Also, advocacy work is part of this. We have continued with the advocacy work. What we have seen as a benefit so far from the integrated approach, that when you work in the selected, specifically selected communities, covering all of the household members, we ensure that no one is left behind. So now when the person enters for inquiry, can also offer a paralegal assistant or can refer the person for the paralegal assistance in the office. So all of the needs are met. And if the person is coming for paralegal assistance, he can also be, he or she can also be educated on the issues of social accountability. Conducting the entry point and entering in the same households very often and visiting them very often, both to address their needs and to offer them more services. So that is how we increase the empowerment and the mobilization of the community members. Also increases the ability of the community to recognize their health rights and to recognize their needs, which will result in expanding the scope of the work in the future. We are now looking to expand the scope of the work currently. We increase the effectiveness of the work of the facilitators and animators because now they have specific division and they can offer broad scope of services in their work. So now through the offering paralegal assistance and combining the data, because we didn't combine the data before from paralegal work and social accountability work. Now we can, by combining this data, we can enable identification of collective violation of rights, which could be addressed by both of the concepts, not necessarily just by individual paralegal cases, but if there is a prevailing problem in the paralegal area, we can include this problem in the social accountability work. And also, we are planning to interlink the data gathered through the entry point and to the paralegal assistance. So in order to get a clear picture for all the health rights and all the barriers which Roma people face in their community. Next slide, please. We as an organization, we do the monitoring and evaluation of the work of the organizations through the reports, through regular visits, regular meetings. We have also prepared a manual for their work. We are following their work regularly, and we are assisting them regularly and upon their needs. Next slide, please. Yeah, and briefly, this was it. I hope I didn't took much of the time. Thank you very much for your attention.
Thank you, Dr. Borjan, for very vividly describing about your work. So now I would like to invite the second speaker for the day, that is Fadil. Fadil comes from the Roma community in Macedonia. His long-term work in the NGO sector has made the community recognize him as a person who can offer help to people who are socially vulnerable and live on the margins of society. He has worked with several NGOs in different positions, starting as a volunteer translator from Macedonian to English, assistant and project coordinator. He is currently working as a project coordinator in a project titled Social Accountability and Legal Strengthening of Roma Community in Orizari. Sorry for the mispronunciations. Now I would invite Fadil to kindly take over. Fadil.
Hello everyone, good afternoon, and hello to viewers of the Kopasan webinar meetings. My name is Fadil Jamal, coming from Skopje, Macedonia, from Roma settlement Shuto, well known in the world as a Shutka. I don't know if anything left to say about the concept after the Borjan presentation, but I will try to shortly to focus my work in the community, in the Roma community, in our Shutka community. Firstly, Borjan many things said, and that Roma are homeless and lives in the margins of the society in every country where they are living. So, but still I believe there is enough place in the planet, and the planet is our home, and there is still a place to live in these planets. You know that the most of the Roma are marginalized and living on the margin of the society in every country. So the situation is the same in Macedonia. I am living in the Roma settlement named Shuto Orizari. Officially, we are mostly Roma, and around 30,000 people, Roma inhabitants, and 80% of the inhabitants are Roma. We are facing with so many problems, every kind of discrimination, but what we are working exactly is with promoting health rights and improving health conditions of the Roma people in Macedonia. So my organization's name of our organization is IRIS, or Initiative for Development Inclusion of Communities. IRIS was established by a group of 9 experienced, dedicated, and professional Roma and non-Roma young students, graduates, and all the people from the community, with the initial objective joining the existing individual capacities for achieving visible results in the communities where we live. Mostly, Borjan has explained about the concept, but I will focus to explain regarding paralegals and paralegal helps. Sorry, I have some problems with my laptop. The IRIS team has been involved since 2011, as Borian said, in the implementation of the paralegal assistance and social accountability. In all those years of implementation of paralegal assistance, our NGO has been successful in helping the local population and has become recognizable as a service for citizens with around 300 cases yearly. But not only for the citizens, we become recognizable also from the state institutions operating locally, such as Intermunicipal Center for Social Work, Department for Legalization of Houses, Office for Management of Register of Births, Marriage and Deaths, and etc. The number of our clients from year to year is increasing, and it's seen that the community needs help from well-trained paralegals who will be able to work under different circumstances and in the interest of the community. As Borian mentioned before, IRIS provide paralegal assistance and support regarding the achievements of the Roma health rights, the right of health care, obtaining health insurance, and the protection of patients' rights. Apart from this, we provide support in violation of other basic human rights, such as social protection, housing, employment, and etc. This depending on the need for what they will contact us. So regarding this, in order to improve the social and health life of the Roma inhabitants in our Roma community, firstly, what we have done according to the project activities is mapping of the community. So as you heard before, Shutka is with the 30,000 inhabitants and is the probably largest community, Roma community in the world, with the only Roma mayor in the world. So we decide to take some parts of the Shutka to work with the locals. Mapping was done in such a way that every household was noticed how many members there are, how many are employed, recipients of social assistance, retirees, how many are minors, and so on. With this activity, we received more detailed data for each household in the predefined localities. After the mapping, the next activity was the implementation of the questionnaires. I would like to explain more about the questionnaire because you in the Borian mentioned more about the questionnaires. Just to mention that also the colleagues from the SA partner organization, in cooperation with the Johns Hopkins University from the USA, prepared a questionnaire. The questionnaire is in electronic form and tablets are used for its implementation. This was for the first time using such a kind of conducting questionnaire with the locals. After mapping the localities, we recruit animators and facilitators also. Animators are people from the community whose initial task is to provide entry to the households in the areas where the organization will operate. Each animator is responsible to maintain regular contacts with the identified 50 households in the area in charge of him, to be in constant communication with the facilitators in charge of the area and together with the facilitators to conduct the initial interview, as well as the subsequent interviews in the family to assess the situation of the family. Regarding facilitators, are persons who have previously been involved in one or the other concept and are trained to provide legal advice, information, conducting community assessment interviews. Each facilitator is responsible for communicating with 2 responsible animators in the area in which he will act. With their help, they will establish initial contact with the families, will conduct the initial questionnaire as well as the subsequent questionnaires for assessing the progress of the family. The facilitators are also trained to provide paralegal assistance in the fields of provision of health care, protection of patients' rights, health insurance, and social protection. For each identified client, they will keep a file and will take care of monitoring the cases continuously. The role of the animators and facilitators were significant. The locals began to recognize violation of their health rights that they did not even know that they can invoke them. The reports on illegal service payment of gynecologists increased. Also, there has been an increase in the number of Roma women who have registered for the pap test and other services, and the regularity of a visit to a gynecologist increased. Now the community knows what to look for and how to exercise its rights. Providing this model of community access, which besides allowing greater representation and participation of the population and familiarization with the services offered by the team and institutions, enable a more systematic transfer of knowledge through educational workshops and focus groups. Given the established regular communication between animators, facilitators, and the community, information is provided on how much of the knowledge gained from community members has helped them in everyday life, in the realization of their health, social, and other human rights. In this term, I would like to mention an example with a Roma woman who doesn't have any kind of personal documents, and during the given birth in the hospital, in the state hospital, authorities from the state hospital refused to give her assistance and any kind of medical help. So after acting as a paralegals and have meeting with the authorities, they decide to give her. They decide to give her assistance, help, and to give the birth in the hospital. But to ensure themselves not to escape from the hospital, they took the children from the mother during the night. They ask about the money to pay private the giving the birth of the child. So we act and made some meetings with the lawyers with the hospitals. They explained that if people doesn't have any kinds of documents, they have to give birth in their houses, not to come in the hospitals. Even in the 21st century, that was a horrible situation to experience such a kind of violation of human rights. Another examples that I would like to mention in this direction is with the help of our paralegals, we identified a person who had a brain tumor, brain cancer. So also the people from the urgence, they refusing to give him support, medical assistance and support, and to bring him to the hospital to operate the brain cancer because of not possessing any documents. So again we are managed somehow to and success to bring him to the hospital and to be accepted from the doctors and nurses, and to have a surgery in the brain. Again, these two cases saying us that there is a all the time somehow violation of their human rights, not accepting Roma as equal citizens in the society. But having in mind that our paralegals and animators putting so much efforts in the community, so we can say that we have many successes and results achieved. One of the most benefits of providing paralegal assistance and support is promotion of the level of awareness among Roma, both individual and at the community level. understanding of the rights and responsibilities of Roma, not only in the field of health, but also in the field of social protection. Changing the legal status related to the fulfillment of the rights to health and social protection, a change in the behavior of Roma towards themselves and towards the community also. A clear sense of civic equality, open opportunities for expressing the needs and attitudes of Roma in the public and orders. Also, beside the violation of health rights, we have a violation of other rights, and we are helping them. We are helping them according to what we are trained and depending of their needs. For example, often they are coming to our office and asking for when some social rights are violated, legalization and other, and for employment, for example. But even we are doing a great job in a community and have a direct access with the locals. So still the community needs help from well-trained and educated paralegals because it is not yet able to act independently. So therefore, with the technical support of ESE, we have created a strategy where we precisely define goals and activities in order to improve the health image of the local Roma population in Jutorizeri. So I hope I explained our work as a Roma NGO working directly in the Roma community, and waiting for the questions in the next session. Thank you very much.
Thank you so much, Fadil, for sharing your experiences. And now we would open up for the question and answers. If anybody has some questions, comments to make, then I would like to invite COPASA Global Secretariat Coordinator Edward Premdas to kindly facilitate this session, the question and answer session, and then we'll have a summation of the webinar today by Premdas. So kindly take over.
Thank you, Borian, and thank you, Fadil. I think it's a fabulous presentation from your side, and connected. You are in some other part of the East Southern Europe, somewhere in the communities, and we are in some people in India and many other friends from different parts of the world. Though there are some little bit of hiccups in between, I think the presentation was very beautiful and it went on well. So I would now like invite our friends. If you have any questions, we open it up to you, and you can unmute. You can keep your video on if you like, and unmute your audio. And you can. Anyone would like to ask any question, kindly identify yourself, your name, and where are you from, and keep your question short. What we will do is that we will take about 1 or 2 or 3 questions at a time, and then you also indicate who are you referring your question to, and then we'll proceed. So with the brief question and answer, we can go ahead. So if anyone is ready with any question, kindly unmute your mic and you can ask the question. Yeah, okay, let me, since as some friends might be beginning to think about some questions, I have 1 or 2 questions, one question to begin with, to Fadil. The paralegal work that you are speaking at is very interesting. Can you give an example other than health? What kind of, I'm saying, if you can give cite a small example, what kind of a case came to you and how did you go through all that? Because one, you said in many places, the Roma people are not recognized as citizens. So they don't have documents of their own. So how does your whole process of helping them, what happens? The second question is, how does the judiciary or your administration system respond to you? Do they, and what are the challenges that you face on the way? So if you can take it through a small example, it would be very good. You can answer this question, then we will wait for other questions to begin with. Fadil, you.
So thanks for the questions. And as I can understand, the questions regarding the people without any possessing any kind of documents, we have put pressure over the authorities, state authorities, in this case directly to the Minister of Labor and Social Policy, and we are active participating in a group for persons without IDs. So with support of OSC mission in Skopje and UNHCR, we are trying to provide them documents or somehow to register them as a citizens in Macedonia in order to get social health and any services. So at the moment, these are at the moment we are it's a public public announcement for all people who are not possessing any kind of documents to register themselves in our office or in the office of the states or department for leading the this kind of registration, and to get some like ID numbers to be registered in the police in the to be registered and to get assistance for that. If I was clear, I don't.
Okay, thank you for that. We have two friends who have sent the questions to the chat. I will direct it to Dr. Boryan. Then maybe Fadil can add. The question is from Kamayani from India. Thank you for the presentation, which were very informative. So Kamayani is working on the issues of gender, health and rights. So her question is to know about the status of mental health of Roma women, and also if you can throw some light on the issues of LGBT, that is sexual minority, the lesbian, gay, bisexual and transsexual, transgender and sex workers in the Roma community, how they are dealt with in the health sector. This is the first question. And her second question is on the film. The first woman who said she is a grandmother looked quite young, though we could not see her the face. But is the child marriage an issue within Roma, and does the law say about it? What about the child? Is there a prevalence or rampant child marriage, the age of marriage in Roma community, and what does the law say about it? So, Boryan, can you just address these two questions first?
Thank you, Prendas, and thank you, Kamayani, for these questions. I will first offer answer, and then I will also ask Fadil if he has anything to add after me regarding the questions.
Boryan, please keep the mic closer to yourself so that we can hear you loudly. Yeah.
Now, just the settings are continuously
yes.
changing.
Okay, now we can hear you properly. Yeah.
Okay, just a moment. Yeah. Okay, I was just saying that I will offer the answer first, and then Fadil can add up more from his perspective from the Roma community. Regarding the thank you Kamayani for these excellent questions. Regarding the mental health of Roma people in general, so far there was almost no data at all. Although one can presume that there is a poor mental health for this very marginalized community. Our last data from the 2017 shows some really worrisome situation regarding mental health. These are just provisional data so far, and we have not yet published them. But from what I have seen, is above around 70% of the population, which were in municipalities where we work, suffer some form of which is from mild to severe, which is very worrisome, and it shows us that probably this is an issue which should be addressed more in the future. Also, I see the problem that not just us, nobody has never addressed mental health of the Roma people. Maybe because there are so many problems, and maybe this issue was put aside. I don't know, but it's really a big problem and should be addressed in the future. Even I forgot to mention there was a national action plan for health of Roma people in Macedonia in 2005 until 2015. Now we have a new national action plan, a new strategy for Roma inclusion. But yet, in none of these documents, these are governmental documents, in none of these documents the mental health of Roma was not addressed. And I think this should be changed in the very near future. Regarding the rights and access to health services of the LGBT population and the sex workers, I will give an overview. We are not particularly working with this population. There are other NGOs in Macedonia which are very actively working with LGBT and with sex workers and so on. These people face many barriers in general in access to healthcare, because especially discrimination. In a couple of years, the sex work in Macedonia is not legal. So it's not legalized, sex work in Macedonia. The sex workers cannot be prosecuted for what they are doing, sex workers, no, but those one organizing them, they can be criminally punished. But we had a couple of years ago a situation where the sex workers were forcibly taken by the police to be examined for transmissive diseases, for STIs, for hepatitis B, and even the prosecutors tried to put a prosecution against them for one criminal act for intentional spreading of infectious diseases, which was a very, very improper case, and many NGOs reacted upon this. Also, there is no treatment for transsexuals if they want to change for transgender, sorry, if they want to change the gender and so on. There is no such procedures in Macedonia. Regarding the Roma community, if I don't, maybe can speak more about this, but this is kind of a hidden issue, according from my perspective, my more than 10 years work with Roma communities. So these people, from my perspective, face double discrimination. One, because they are Roma, and the other because of their LGBT status or sex work. And they suffer both from the public institutions, but also within their own community. So they face even more problems than the general LGBT and sex worker population. But unfortunately, also there is no Roma civil society organization which works with this vulnerable group of the population. But other NGOs which are working with the LGBT or sex workers also include all sex workers regarding their ethnicities. I hope that this is answer from my side, so I will ask also Fadil if he has anything to add.
Thank you, Borjan. Yeah, Fadil, do you have anything to add about the mental health part? The second question is about the child marriage and other things. So, Fadil, do you have to add anything about the mental health and the sexual minorities and sex workers and their health issues?
Regarding the mental health, in the beginning, because these questions was included in a questionnaire, and we are facing the problems during asking the people to answer regarding these questions. But after explaining what contains the questions and what it's about, and what do we want to achieve in this direction, people understand us and openly answer the questions. Yes, maybe we can say that because of the pure indigenous people, it's talking about indigenous people, illiterate people, Roma people are very poor and they are facing with everyday difficulties. So the mental health is it's not in good conditions. So the people, Roma people, trying to survive day per day. So they are living only for today, and they doesn't know what they will expect them for another day because they have no regular salary. They are not employed, and also the social insurance is very low in Macedonia. So these are about the mental health. But regarding the child marriage in Roma, among the Roma, the conditions is improved, and it's not like the before 20 or 30 years maybe. Now the most of the Roma are going to study to study. They are going to enroll themselves in the faculty, but there's still cases with a child marriage, but not often, not significant like the previous years. Regarding the sexual workers, we are not working with the sexual workers or LGBT group, but as Aborian said, they are discriminated. They are not enjoying fully the rights in the country. Among the Roma, it's a strange maybe, but I can openly say that they're enjoying full rights like the others in a local level. I am saying they are discriminated by the institution. They are discriminated by the by the others, but among the Roma community, they are not discriminated. We are living together with them. We are accepting them like our friends, our relatives, our neighbors, and so we are not prejudiced regarding these sexual workers. Thank you.
Okay, thank you, Fadil. There is before we come to questions on TB, that is by Brajraj again from India. There's another question that from Kamayani regarding the home births. The question is childbirth in hospital in India is preferred due to various health reasons. But in India, we do see sometimes traditional birth is essential for another to survive, a mother due to accessibility issues. What's the status of traditional birth attendance in Macedonia? So basically, suppose there are home births in Macedonia, and how it is attended to, and are there traditional birth attendants who have the traditional knowledge of assisting in the birth and on those processes? So what's the status and conditions in your communities? Who want to go first? Borjan? Yeah.
Can you hear me well?
Yeah, a little louder. You're closer to your.
Yeah. Okay.
Yeah. Okay. Yes.
I forgot to address the issue on the child marriages. Regarding the legislation in Macedonia, it is legal to get married after 16 years, but with the consent from the parents. And after 18 years, you can marry by your own will. Regarding the early marriages among Roma community, usually they are not registered in front of the state, but they are just traditional marriages. And in that case, by the law, it is like if the person is below 16, it will be like considered like a sexual assault against minor. It's not legal, but it's a reality. It still happens, as Fadil said, not as much as in the past, but these traditional marriages, child marriages, still happen in Roma communities, and there are some NGOs addressing these issues to reduce the child marriages. Okay, that was about that. About the deliveries at home. In Macedonia, around 99% of the deliveries are carried in the hospitals. This is general statistic. Among Roma, there is no clear data, but from our findings and from some other NGOs, probably around 10% or maybe more of the births are carried out without attendance from the health professionals, which is worrying. Even if it's 10%, not more, it's still worrying because this is not the case among the general population. In our system, we don't have traditional birth attendance in Macedonia. There is no such classification. In Macedonia, the deliveries are conducted by the OBGYN, gynecologist, and midwives. But also these midwives are working in hospitals. So there are home births within midwives. You mean midwives? Yes, we have midwives, but they are not authorized to do home deliveries. They, of course, just in emergency, but they work in hospitals, the midwives. And yes, those deliveries among Roma which are conducted at home are without any midwives or any health staff. They are conducted without health staff attendance.
Okay, thank you, Borian. We move on to another theme, that is the question is from Braj from India, working on tuberculosis. There are two questions. One is, what's the prevalence of TB, tuberculosis, and how much money do Roma people receive under social insurance scheme for institutional deliveries? Okay, that is about delivery. So one is about tuberculosis prevalence. You can explain a little bit about being marginalized, poor, not having access to nutritious food. One can imagine tuberculosis might be an issue with the community. And second question is about any social assistance or insurance for the institutional deliveries that happen, the childbirth in the institutions. Yeah, Borian, first to you and then to Fadil.
Yes, thank you for the questions again, Brajarai. The prevalence of TB in Macedonia is quite low. It's around 15 cases per 100,000 of population. Very low prevalence in Macedonia. Although I must say that our health statistics are not very good in general, and this is the official numbers. And because due to poor health statistics, we don't have exact prevalence among Roma. So the health statistics are segregated according to ethnicity. So we don't know how much of these cases are Roma people. And in our research, so far we didn't include TB as an issue. But definitely one can assume that it is much higher than among Roma facing the poor, as you said, poor nutrition, poor access to health services, poor housing. But yet, no official data regarding TB among Roma. Regarding the delivery in hospitals, the delivery in hospitals is free of charge. In public hospitals, it's free of charge for everybody, regardless of the health insurance status. So even if the woman does not have health insurance, she can be delivered in the hospital free of charge. So even the women without documentation, which is Roma people are most often people without documentation, even they have a right to have a free of charge delivery in the public hospitals. If you have anything to add, please.
The question is, do you have any additional assistance? For example, like India, you have some cash given to the woman so that it could be of use during her is there any additional for the nutrition and compensation for her, leave from work, then all the loss of pay? Is there any special cash or other assistance apart from free care for the woman who delivers in the hospital?
Okay, I didn't understand that. Okay, yes. There is for each child, there is one small amount, around 100 euro, less than 100 euro, given by the state for after the delivery, but only once. Around less than 100 euro only once, and each municipality decides whether they will also give some assistance to the woman. But this depends on the municipality. Also, they give an amount from 50 euro to 100 euro only once. That is the case. So you are entitled to both. If your municipality has decided to give you assistance, you can get the assistance from the municipality and from the state. If your municipality does not have this assistance, you can get only from the state. Our previous government, but yeah, this was mainly a bit to some populistic measures and some, let's say, nationalistic measures do not go far in. They have made changes to the law, so all the women that have given birth to 3 or 4 children, they get social assistance for the 3rd child and for the 4th child. Some monthly amount of, I'm not sure, around 150 euros, something like that. But they receive this amount each month for the 3rd child, and there is also some provisions for the 4th child. I'm not quite sure, but this was more because of the birth rate in Macedonia, among Macedonians especially, is declining. So the previous government wanted to boost natality among Macedonians. So that's why this measure was used. So if I look anything to add.
Thank you, Borjan. Fadil, do you want to add anything on the prevalence, or if you have seen persons with the tuberculosis, or what is your experience with the communities? Are they suffering from tuberculosis? Is there a treatment available? Is there screening of such patients? What is your experience while you were working in the communities there? Fadil.
Sorry, I didn't understand exactly the questions.
The one question is about tuberculosis, TB. So, okay. Are you aware of TB? Yeah, is there, the question was, yeah.
No, the prevalence of TB among the Roma community is not often. There is some cases, but not often and not regularly. So is
okay.
Not the case. Not the case.
Okay.
Regarding the social insurance scheme for institutional delivery, Borjan explained it, but just to add the same things that every 3rd born babies, the mother is receiving 150 euro, and for every 4th born live born babies receiving around 200 euro, and for the first category, these are in last of 10 years, and in another the 4th baby who has a 4th born babies receiving till 16 years insurance, and after when the mothers become old, she is receiving a pension.
Okay. Thank you, Fadil. Any other friends? Do you have any question to ask? I think we are now almost covered 90 minutes. I think some of you will leave. So I hand over. Thank you for the wonderful questions. I think one thing that came strikingly was that in India, we have. I'll just. If there are no more questions, let me just give my concluding remarks, and I'll hand over to Surekha. So I think Borjan, you have highlighted your approaches to the struggles and issues of Roma community, Roma people, the legal and social accountability approaches, which includes advocacy for their rights. I think it's a very important one, and we got to know quite a lot from what happened at the ground level, from IRIS, from the organization of Fadil, and how when the rights are denied, when there is no documentation, they are denied entry into the hospitals, how assistance takes place by the paralegals and facilitators at the community level. I think it gave us a view from both sides, an overall approach to your work of empowerment of Roma community, and how it rolls out at the community level. I think it was wonderful to have both of you. And what came out strikingly at the end of the discussion was, in India, we have a different situation. That is, if you have more than 2 children, in some states, the law is passed and policy is incorporated to make you ineligible, even for some jobs like teachers, nurses, and you can't contest elections if you have more than 2 children. So you have the other side of the problem here, where we have which also excludes and discriminates the poor very by and large in a great manner. And we do have certain campaigns against this discrimination, because how many children one should have should be the decision of the couple, regarding and not the state should not intervene to say how many children you have got. So we have disincentives if you have more children. And at your end, I'm delighted to hear that there are incentives for having children, and that is support for the community. And I believe that even this 100 euros, 150 euros are allocated or available, the Roma community is able to access it through your help. So thank you very much for this, and it was a wonderful discussion with you all. Now I hand it over to Sureka. We have certain appreciation from participants, from Brajraj, wonderful presentation and discussion, and also appreciation from others, Carmine and others who have enjoyed your presentation. Now I hand over to the coordinator of the COPASA Social Accountability Dialogue webinar to Sureka. Over to you, Sureka.
Thank you so much. We thank all our participants for joining in today, and we thank you for being patient enough to hold on during the entire session. As said earlier, we've gone over 90 minutes, and we would like to especially thank our speakers for the day, Dr. Borian and Fadil, and also thank COPASA Global Secretariat Coordinator for facilitating this dialogue as well as introducing the theme. The recording of the dialogue will be available shortly, and if you have any comments, suggestions, and want to join our communication group, that is our listserv, please do write to us on copasanet@gmail.com. And as it was mentioned in the beginning of the dialogue, that we'll be shortly bringing you the second in the series of this dialogue, the stories of Roma struggle from Bulgaria. So do watch out for the information on this, and we thank you all for participating in the dialogue. Thank you so much.